Hello, everybody. This is Anand here. Snail, can you just help if you can help me if you can hear my sound?
Yes, Anand, it's clear.
Okay. Thank you, Snail. Hi, everybody. We are just waiting for Dr. Trishla, and we'll just join in a minute or two. Yeah. Hi, Dr. Trishla. Good
Hello,
evening. How are you?
good evening. Nice and anxious. Thank you.
So, welcome, Dr. Trishla, and welcome, everybody. We'll be starting off the session now. Um, Dear doctors, yeah, we welcome you all to our seventh Gyaan Vardhini session today. We thank you all for attending this session. With Gyaan Vardhini, enhance your wisdom, take your practice to the next level. Our today's session shall be conducted by Dr. Trishla Gala. She is a BAMS, NLP, and Gestalt Master Therapist. Dr. Trishla provides consulting as an Ayurveda practitioner and a therapist at Dr. Rishabh Gala's Ayurcare at Matunga East and Neocare Orofacial Pain Management Clinic at Vashi. Dr. Trishla is working as an Ayurveda practitioner since the last 14 years. She believes in dealing with the emotional root cause by using different counseling and therapy modalities like NLP, Gestalt, transactional analysis, and much more. As per Dr. Trishla, as major diseases are manifested, are psychosomatic, a combination of Ayurveda medicines for your gut health and therapy for mind, and emotional health helps one gain good health. Dr. Trishla caters to holistic healing modality for depression, anxiety, phobia, fear, relationship problem, feeling stuck or confused, physical ailments, etc. So let's walk the talk. Today's topic is Doctor Patient Perception and Perspective by Dr. Trishla Gala. So before we go ahead with today's session, we would also want to apprise you all about our clinic management app called ClinSav. This is the only app that allows you to manage your clinic in a 100% offline mode with a super simple design. Moreover, ClinSav team is coming up with a feature having curated medical information called MedBits as part of ClinSav in late August this year. MedBits shall provide you topics on the latest medical news, diseases and disorders in the world, medical fun facts, research papers, Gyaan Vardhini webinars, and much more itself within ClinSav. To know more, you can connect with us through our website, clinsav.com. I hereby now hand over the session to Dr. Trishla Gala on the topic Doctor Patient Perception and Perspective. After you, Dr. Trishla.
Thank you so much, Anand. That was really nice. I have a request for everybody. Is it possible for y'all to switch on the camera? And if because I want this to be more interactive, I want more participation if possible. Because if y'all raise questions and we could interact, would be really a good way of learning. So can I wait for a minute? Can I see your faces, please? Everybody. It would really be good. As you all are doing the settings and everything, uh, I want you all to also ponder into your own lives and see what is the trouble. What is it or where is it that you all are stuck? You're feeling stuck. If you can understand, try and make a note of it. In this session, I'm not going to talk on Ayurveda, as you know. I'm going to talk more on why do you need therapy? Why do you need counseling? You know, once upon a time, Ayurveda was a taboo. People were not open to Ayurveda. Thanks to COVID, thanks to Ramdev Baba, it's more open now. Similarly, counseling therapy has also been a taboo. Have you heard somebody saying, "Oh, I'm going to a psychotherapist"? They say, "Mad you are you nuts?" या कोई बोलेगा जा जा मेरे को प्रॉब्लम नहीं है तेरे को प्रॉब्लम है तू जा. Have you heard these things? And do you know at the same time, of course, everybody knows 90% of problems are psychosomatic, isn't it? वो मेरा डिपार्टमेंट नहीं है साइकियाट्रिस्ट का है मैं काय को डाल. So who will cater to it? Only the psychiatrist? When the damage is done massively, it is psychiatrist who will just give medicines and who will shut down the cognitive aspects of a person. Do you believe that? Do you think that happens? And you know, still the worst scenario is that even the psychiatrist, they do not send the patient to the psychologist or the counselors. You cannot change the situation of your life without changing your thoughts, without changing your beliefs, and without taking different actions. Do you believe to that? So, what is our duty as Ayurveda doctors? Why? Ayurveda really concentrates at the root level of the problem. That's why it is special. But in that speciality, I really feel we need to inculcate what is still a deeper root cause of the physical problems. And that is where the psyche and the soma comes, right? The psychosomatic. What is health according to you? Could you type, could you just or unmute yourself and tell me what is health according to you? Give me two, three answers. I just want to know what is health, maybe in a sentence, in one sentence.
Physical, mental, social, and emotional well-being of the person is the total
Living,
health.
okay, that's nice. Physical, mental, social, and emotional.
Emotional.
Emotional, okay. Physical and mental, I don't care of the emotions. Is it? Okay, physical, mental health with consciousness. I really don't care of emotions. It is my husband's duty or it is my father's duty to take care of my emotions. Agreed? Do you see how? No. Thanks, Sheetal. You're right. But are we really spreading the awareness how our emotions are our responsibility? Yes, physical and mental health, yes, but emotional is suppressed deep down into subconscious. Do you know what the root cause of the problems are? Yes, mental health includes emotions. Some people do consider that it is included, but most of them do not know that it is included. And moreover, people don't want to talk about it because we always feel we'll be judged. Health is mental. How was that? What did Dr. Srikanth write? Could you read it again? Anand, could you just read what Dr. Srikanth wrote?
Yes, yes. Just a minute.
Physical, mental, and enthusiasm, what?
Health is mental and physical well-being and enthusiasm to do work when you wake up. This is from Dr. Ahmed Savani.
Okay, sorry.
Yeah.
Yeah, but enthusiasm, do you think you are having the same kind of enthusiasm from morning to evening or all 24/7? Who keeps up the enthusiasm or whose duty it is to continue the enthusiasm? So, for whatever I dived into this world and I'm still work in progress, whatever little I have understood and little that I can portray, and it is more to spread this awareness that let us touch up on this aspect and not neglect it. Once upon a time or earlier days, people used to have family physicians, right? One doctor for all. But those family physicians used to solve their problems, not only just the medicines. So the human touch has been lost drastically. Do you all agree to that? And worst is, we have lost the humanness towards ourself itself because we are busy being the doctor, we are busy being the mother or the whatever roles you are playing, we are forgetting our own self. So I'll try to chunk down little by little. Perhaps the it must be you must have heard it, but I'll try and give you a different perspective to it because I've seen deeper hurt and pain being the root cause of all the physical problems as well. So, Anand, I would request you to start with the PPT. If any
Yes,
questions
Dr. Trishla.
during this, thank you, Anand. If any questions, please jot it down and I will try and see if I can answer those. So let us understand what is the difference between perspective and perception. Yeah, next. Perspective, it is a particular framework or a point of view in looking at things. And perception, it is the interpretation given to the different perspectives according to the experiences that one has had, which is definitely not the same for anybody. Anybody. Now, for once during this session, what I want you all to do is, for example, again, my example, Trishla is looking at Dr. Trishla and looking at the patient in a different way. So you are like a surveillance camera, like you not wearing the hat of a doctor. Okay. And so it's Trishla as an individual, Trishla as a doctor, and the patient. So there are three people in the scenario. Now, as an aerial view or the second surveillance, I want you to see the perspective and perception of Dr. Trishla and the patient, and you will have different ways to see. You don't have to use this framework only for the patient, but try and see for yourself also. Yes, Anand, next please. So what is this? Thoughts. Whatever we think, it is this sensory information that we get from the external environment. These thoughts are then transferred into the brain by electromagnetic reactions and causes a memory box, which is the internal representation of your past experiences. It can be positive or negative, which then triggers the emotions, which is the end product of our experiences. What is this internal representation? Whatever you have thought, it has been fit into your subconscious in a certain pattern, which you are not aware. That is the internal representation, because when you are younger or whatever you see, it is not the exact way you store. You give a certain meaning to it, you give a certain interpretation to it, and that is how you store the experience through the interpretation that you have given to that experience, and that is going to cause emotions. So that is the end product of experiences. Next, please. These thoughts are captured through these five senses. Sometimes somebody has a strong visual or auditory or kinesthetics, olfactory or gustatory. All these thoughts, these create feelings, which is then manifested in two biology. One is external and one is internal. So in Ayurveda, what do we see? What is darshan pariksha? It is that external biology, right? But you are looking at the symptoms of the problems and now have the perspective of understanding beyond that. What is their body language, posture, orientation, behavior, and tone? You will really understand whom are you talking to. Is it the child like or the childish patient? You can understand the behavior of patients sometimes. बहुत ही childish behave करता है, बहुत bossy behave, उसको तो बहुत attitude है. You must have seen these kinds. Don't let this go amiss, because all these aspects will tell you the emotional aspect of your patient. And once you recognize that, you will be able to deal with the emotion of the patient in a better way. And the other is internal biology, wherein, of course, there is stress building up or the hormonal disturbances happening because of that. Next, please. So, what is this law of thermodynamics? We all have this energy, right, which is never created or transferred, but always, never created or destroyed, but always transferred. So, human body contains this energy. Have you ever seen or this situation in which, तुमको पसंद नहीं आता है, भाई भागो यहाँ से. I don't want to face it. Who will face? So you kind of run away from your problems so many times. Please observe, take a pause. Observe where you stand. What role are you playing? Are you running away from something, or are you really fighting it or facing it head on? So there are two responses: fight response, which is very smooth and it will not cause any anxiety there, and the hormones are secreted normally. But there is another, flight, which is blockages of energy, weakness, dysfunction causing indigestion, BP, panic attacks, and much more. And I'm sure you know the list is big. Next, please. Belief effect. Thoughts take over our body. जैसे एक हेतु में कहा गया है अति चिंता, सुना है ना, एक छोटा सा वर्ड है अति चिंता. अरे डोंट ओवरथिंक यार, रियली ट्राई स्टॉपिंग इट, very difficult. So thoughts take over our body and beliefs allow us to treat ourselves with our mind. Mind can be a powerful healing tool if it is given a chance. The placebo effect, that is belief, is more than the positive thinking. It's about creating a stronger connection between the brain, body, and how they work together. We always say that mind and body, they are all interconnected. But we do not know the flaws. We do not know how mind is affected badly, because that part we ignore. For example, how the doctor addresses the patient who is suffering from some kind of illness. Some people, they are so blunt. Some doctors, अरे यार तुमको cancer है. You won't live longer more. You just have. They're so blunt. And some people, they give assurance, ashvasan chikitsa, right? But that ashvasan देने के लिए, are you ready in your body, mind, and soul, in your posture, in your tonality? It's very, very important for the patient to understand that this ashvasan is genuine or not. For that, are we keeping ourselves in a genuine state or not, is what we need to introspect all the time. Next, please. So research shows that brain responses to an imagined scenario is very much similar to an actual visualized scene. So this helps the brain to remember and visualize a time in the past when symptoms of illnesses like pain, etc., did not exist. Helps bringing change in the body and achieve a previous normal state remembered wellness. Anand, could you stop sharing the screen for a while, please? Are you all ready for a little activity that everybody will do? Or, yeah, or do you have any state wherein there is a dilemma? There is good, bad, right, wrong, confusion, anything that anybody is dealing with right now. Anything that is more stronger, can you all raise some hand and get into the activity? If you experience this, it will be a better learning. I wait for a minute. Oh, so difficult to face your own self. Dr. Sudeep, do you have a dilemma? No, I'm still sorted in life.
Can I talk?
Sorry, I can't hear you. Rupali?
Yeah. Ma'am, this is Dr. Rupali Patil here. Can I speak?
Yes, you can.
Ma'am, what kind of dilemma means it is a very small thing you're expecting or a bigger thing?
Is it small for you or is it big for you?
For me, it is big.
Then it is big. Who am I to tell you that you should take small or big?
Ma'am,
Do
actually,
you?
since last 20 years, I'm running both the OPDs, morning and evening. Since
Hmm.
last 1 year, I'm thinking of running only one OPD, that is from 11:30 to 5 or something like that. But I'm not sure how it will help or how it will work, because many of my patients and lady patients also, they are working and they find evening OPD better. So I can't take decision ki, whether I should go for this or not.
Okay. Could we have her in the main screen, one screen, Anand, if possible? Could we have Dr. Rupali on one screen?
Yes, I'm doing that. Yeah.
Yeah. So everyone, I want you all
Is this
to
better?
observe. I can't see
Or
Rupali. Are you?
no?
I can't
Yes,
see her
it
camera
is
if
there.
it's on.
So my camera is off, sorry.
It's still not visible enough. I can see the screen green. Anand, is that
Yeah, there's
your
a no. I think it's
her
uh
video?
yeah. Dr. Rupali, could you please just close the camera and start it again? Maybe that will solve the problem. We see you as
Okay.
some green colors coming on top of your face.
No, but I don't know why it is happening. It is still green.
Yeah, we can still
I
see your
need
face
it.
though.
Is so
But
Rupali, Dr.
yeah,
Rupali, is it possible for you to keep the mobile somewhere and have some space behind to move or not? Is it possible for you?
right now I'm in my OPD and
Okay. So
no, but it is still coming green only. Half green, half normal. I don't know.
So, Dr. Rupali, I'm so sorry. Maybe I can't do this right now with you. Perhaps if I do it
Hmm.
with somebody else, you can observe it and you can apply this for yourself as well. And Dr.
Okay.
Praveen is like, use back camera and try.
Yeah, that's a very good suggestion from Dr. Praveen, but I guess she may not be able to see how she's looking.
But I guess, I mean, there must not be enough space because I need her to move a little for this activity.
Yeah.
So perhaps somebody who has a problem, even if it is minor, doesn't matter. It is more of to show how one can have a different perspective to the thing and get their solutions. Maybe she can
Would
learn through
somebody
somebody
want to?
else.
Yeah. Would somebody want to volunteer here?
If you have a dilemma, if you have anything which is, yeah,
We've
somebody
got
is,
Dr. Anju Chetia.
yeah, you can get her on the screen, please.
Yeah.
Video.
Dr. Anju, can you share your camera, please? Thank you, ma'am.
Yes, Dr. Anju. Hi.
Hi, Dr. Trishla.
Yes, tell
Hi.
me. How may I help
Yes,
you?
so I wanted to speak about my problem. Like it's actually regarding my son who has just shifted. Like today was his first joining date, so he has shifted to Pune for a new job. So so I mean, I was feeling how will he be able to cope up in a different city because already there has been a history where he was in another country and felt very lonely over there. He was there for a period of 6 months, but then again, then he was back here. He took up his course, he did his engineering, and now he has got his first job. And again, he has moved to another city. So, that thought in my mind that he should be fine, he should not feel lonely because that loneliness has been there with him because of that past memory, that 6 months where he felt what is actually loneliness called in a different country. So now it's a different city. It's in India, but it's a different city. So this is my dilemma. And today, when I spoke to him on the phone at how was his day, and he said it was okay. So I wanted to know further what means it was okay. So then he said, it's fine, but I'm feeling very lonely. So, my those thoughts that how will he be able to cope up? Though I was very positive. I was always assuring him everything will be fine. So even today also I told him it's the first day. So how can you expect on the first day everything will be good? So it will take some time and you will get used to with new people and all everything. So I just wanted to share that dilemma in my mind and how, I mean my mind will be happy once he is settled happily over there.
Okay. I wanted somebody to talk about their own dilemma, but you have a dilemma with respect to your son. But
Yes.
there is, if because you have said this, there is one concept that I would want to um, emphasize or actually bring into your notice is that you are a mother, right? The mother's job is to hold a space for the child.
Mm.
You know what space? That listen, if you have trouble, I'm there for you. And how young
Yeah.
is your child?
23.
23, 23, right? He's 23. He will learn to hold himself. You are
Okay.
assuring him is one,
Mm.
but this is his journey. And
Yeah.
you have assured him that you are there for him, but
Mm.
you cannot walk for him. Do you agree to that?
Very much.
So, do you see the helplessness that you have as a mother?
No, I don't see any helplessness because I'm very positive and I always
Mhm.
think in a positive direction. I
Okay.
know he is not that way.
Hmm.
So, but I am the other side completely.
So, if you are positive about it, all you need to do is give him some time, observe him every day, talk to him every day, understand what he is not saying. Understand what he's not talking, not what he's talking. Because my father always says we have to learn to read in between the lines, and I'm sure parents are very good at it.
Right.
Right? So you will know when he needs you. Yeah.
True.
So the activity that I want to do is for somebody who is be dealing with the dilemma.
Okay. Thank you so
Yeah.
much.
Thank you. किसी को जिंदगी में डायलामा ही नहीं है तो बहुत ही अच्छा.
Thank you, Dr. Anju.
Thanks, Anand.
You want me to like move further without the activity or कुछ है? Oh, finally, Mr. Sudeep.
I think I am now comfortable to take.
You were not comfortable so far, is what you're trying to say. Okay, now that you're comfortable, please tell me.
Thank you, Dr. Sudeep.
Actually,
Tell me.
BMS में आने से पहले एक लॉकडाउन भी लगा हुआ था और तब ऐसे ही हॉबी करके चालू किया था मैंने. यूट्यूब पे गेम स्ट्रीम करता था स्पेस रिलेटेड.
ओके.
तो उसमें मजा आया था और लकीली 6 महीने में चैनल मोनेटाइज भी हो गए तो इनकम चालू हुई. एक बचपन से था कि पापा के सर के ऊपर जो बर्डन है वो निकालना है करके. मतलब ऐसा है नहीं पर मेरे को बचपन से है कि भी नहीं खुद का खुद इंडिपेंडेंट बनूं. जब से बीएमएस आया अब 2.5 साल हो गए वो पूरा का पूरा मतलब उसमें फोकस चला गया. मतलब जो इनकम थी वो अपने आप आ रही थी पर जब उसमें से फोकस पूरा चला गया तो उसके ऊपर टाइम ही नहीं काम करने के लिए. तो वो इनकम भी बंद हो गया और जो इंडिपेंडेंट था कि खुद के खर्चे खुद उठा सकता था वो दोनों बंद हो गए. अब ये सिचुएशन है कि मैं खुद का भी बीएमएस की पढ़ाई करूं कि वो हॉबी थी वो हॉबी भी कंटिन्यू करूं. अगर हॉबी कंटिन्यू करूं तो मेरा खुद का खर्चा हो जाएगा पर पढ़ाई के ऊपर भी हो जाएगा. इस दोनों कंफ्यूजन में मतलब कंफ्यूजन है. इट्स लाइक फेयर टू चूज वन थिंग. एक चूज करूं तो दूसरा खो जाएगा और या फिर ये चूज करूं तो ये हो रहा है. दोनों मैनेज भी नहीं हो पा रहा. आई ट्राइड कि दोनों एक साथ मैनेज कर पाऊं पर वो नहीं हो पा रहा.
So how much is your discomfort within yourself with this dilemma? अस्वस्थपणा किती जाणवते तुला? How discomforting do you feel with this? Because Ayurveda भी choice से कर रहे हो, मजे से कर रहे हो. गेमिंग किया, choice से किया, मजे से किया. बट वो कंफ्यूजन जो फील हो रहा है उसका डिग्री कितना है 10 में से? How intense is it? 8 है. वंडरफुल. तो आपका जो बैकग्राउंड जो ब्लरी रखा है आप ओपन रख सकते हो क्योंकि एक्टिविटी के लिए थोड़ा सा मूवमेंट लगेगा मुझे.
Yes.
Yeah. I want you all to observe what I'm doing and like how the activity is carried on so that you understand the perspective of the situation that you are dealing with. I hope you are also pondering upon the doctor aspect of you and looking at patient from the third point of view, not just the doctor looking at patient, but you as an individual looking at the doctor, you and the patient. You will have a broader spectrum to see them. Yeah, so you ready, Sudeep? So what I want you to do is, I want you to take one place, for example here, which is your gaming space. Okay? Gaming space. जो आपको लग रहा है वो. I want you to get up, okay? So if this is your gaming space, I want you to close your eyes, okay? I want you to close your eyes and go through all those times wherein you, during COVID, that you had done the gaming thing. And tell me how you are feeling with your eyes closed. Go ahead. I want you to go through those times wherein you were creating, you were earning, you were enjoying. What are you feeling?
It was like complete freedom and सब कुछ कर पाता था. Like दिन के 10 घंटे भी काम करो तो थकान नहीं लग रही थी. और एक सुकून मिलता था कि हाँ कुछ ना कुछ अचीव हो रहा है. ये टारगेट सेट किया, ये अपने आप जल्दी एक्सपेक्ट भी नहीं कर रहा था तब कि इतनी कम टाइम में इतना हो जाएगा, अपने आप हो गया वो मोनेटाइज. लाइक वो फीलिंग
Okay.
अलग ही.
So what I want you to do now, Sudeep, close your eyes. Close your eyes. आणि ते सगळे जे feeling आहे तुला, satisfaction, feeling free, अजून जे काही आहे, where in your body are you feeling that freedom, that capability? Where in the body are you feeling that?
In thorax region.
What is there?
It's like lightness in the body.
How much is it on 10?
Like 10 out of 5, 6.
5, 6 on 10, right?
Yes.
Okay. Now, as the snake sheds the dead skin, I want you to just drop this all here and take another space opposite to you, which is the BAMS. You're doing Ayurveda, right? Ha, take another space and go there. Go another. जास्त लांब जाऊ नको. हा, तेवढंच. Right. Now close your eyes and go through all those times wherein you started BAMS, but you're not earning. You are tied up with studies, meeting doctors, learning more, but you're not feeling the freedom. But what are you feeling here for whatever you are doing? What are your legs saying right now, Sudeep? What are your legs saying? Your legs moved behind. Did you observe that?
Shivering.
Huh?
Shivering
You were feeling little क्या बोलते हैं, instability there in your legs? आवाज पण निघत नाहीये तुझं. Shivering. You're not feeling good there where you're standing?
नहीं मैम, अच्छा तो लग रहा है कि कुछ नया नया कर रहे हैं. मैं भी इससे ज्यादा फ्यूचर में भी अच्छा रहेगा, पर ऐसा हो रहा है कि
सुदीप, आप दिमाग से बात कर रहे हो. I said, what are you feeling? You are thinking and talking to me. I'm saying, what are you feeling?
लग रहा है कि मैम कुछ बर्डन है कंधों के ऊपर, ये भी लग रहा है. और ये भी लग रहा है कुछ नया सीखने को मिल रहा है. मे भी इससे फ्यूचर में फायदा हो जाए.
फिर भी दिमाग से बात. I understood what you're saying. Get it? I get it. So you're feeling burdened. Where in your body are you feeling burdened?
Like back, on my back.
What happened to the lightness that you were feeling on your chest?
My stomach and legs got heavier before.
It got heavier. I want you to notice how symptoms change like this as you change the position. This is called the psychogeography. As you move, your kinesthetics, that is, your feelings, are also different. And it is experience, right, Dr. Sudeep? If you see the way you are talking in this space is less confident than what you were talking on the other space, right? आवाज पण नाही निघत आहे का? ऐकू येत नाही मला. Okay, now leave this again and go back to your gaming space. Close your eyes. Now please enjoy your gaming. What kind of clothes have you worn while you are recollecting that memory? Describe.
Loose t-shirt and joggers like.
ध्यान ही नहीं दिया, तू गेमिंग में है. बोल ना, तू गेमिंग. Yeah. What else are you feeling? What else are you feeling? Close your eyes.
But हाथ में बस वो याद आ रहा है कि हाँ हाथ में फोन रहता था, एडिटिंग करता था कंटिन्यूअस काइन मास्टर पे एंड अपलोडिंग चालू थी यूट्यूब पे बस इतना।
So what are you feeling as you're talking about it?
अच्छा लगा एक्चुअली। हाँ, जब कम्युनिटी थी मेरी डिस्कॉर्ड पे भी थी कम्युनिटी, लोग थे जो देखते थे, उनको भी मजा आता था, मेरे को भी मजा आता था कंटेंट देख के।
म्हणजे तुला असं वाटतं की you are more capable here, isn't it?
Yes.
Okay. Where in your body
Confident.
are you feeling confident? Where in your body are you feeling confident?
सेम नेक रीजन में और नेजल चैनल पूरा ओपन हो गया ऐसा लगा।
Where is the burden?
Burden was there on back,
Was
on my
there?
back.
You're saying was there, is it?
Yes.
आता हे सगळं सोडून पुन्हा त्याच जागेला जा. सध्या तर तू BMS करतोय ना, जा तिथं. हा, डोळे बंद कर. Now go through it again. Take few deep breaths and go through it again. Observe yourself studying, really working hard, sincerely, learning. कसं वाटतंय तुला इथं आता?
पॅक वाटतं ना, कुणीतरी बांधून ठेवलं असं.
बांधून ठेवलंय? कोणी बांधून ठेवलंय जरा? कुठं बांधून ठेवलंय तुला? Which part of your body? Which part of, sorry, come again? Hands, he said. Sorry, I did not hear. Okay. Now, Sudeep, what I want you to do is, these are the two spaces that you had, 1 and 2, right? Now I want you to go behind and look at both of them. Ata tithun, I want you to look at that Sudeep who was doing gaming. Turn towards him. Turn. तुझ्या बॉडी पण तिथे टर्न कर. हा, आणि आता त्याला बघ, तिथून बघ त्याला. The one who is enjoying gaming. त्याला बघून तुला कसं वाटतंय?
I'm feeling happy ना, कि तुका भी तो कर रहा है कम से कम.
हाँ, आता shift towards the other guy who is doing BAMS. बघावं असं वाटत नाही तुला त्याला?
Same.
हाँ,
गधा वर्क कर.
गधा मजूरी
डोंकी वर्क कर.
डोंकी वर्क कर रहा है. हाँ, बराबर, डोंकी वर्क कर रहा है. तो दोनों में से कौन चाहिए तेरे को उधर से?
यही तो कंफ्यूजन है कि हाँ ये भी चाहिए पर ये भी तो करना है.
What are you feeling as you are standing behind Sudeep? Again, look at the guy who is doing gaming and look at the one who is doing Ayurveda.
Emotionally ये चाहिए.
Yes. Do you know how insensitive you are towards the guy who has chosen Ayurveda? Do you know how insensitive you are to him? Choice कोणाची होती डॉक्टर होण्याची?
मेरी है.
Choice तू केलं, पण
Yes.
साथ देत नाहीये तू.
Yes.
Do you agree?
Yes, yes. देखने.
Stay there. तुला फेसच नाही करायचं त्याला. Stay there. What are you feeling? Are you feeling the discomfort?
Yes, sir.
Where in your body are you feeling the discomfort?
Right region, back region.
Because you don't want to take the responsibility of that guy.
Yes.
Do you see that?
Yes.
तुझा श्वास पण शॅलो झालाय ना? श्वास
Yes.
घेता येत नाही ना व्यवस्थित तुला?
Even my back is got sweat.
Yes, be there, face it. निर्णय तूच घेतलेस ना?
Yes.
दोन्ही पण? तू एकीला सोडून दुसऱ्या, can you achieve him without the other or no? Or you will have to accept both of it?
I will have to accept, ma'am, actually.
हाँ ना, अभी झक मार के एक्सेप्ट करना पड़ेगा ऐसा.
Yes.
And what if I tell you these two are your brothers? किसका साथ देगा तू? बहुत पार्शालिटी करेगा ना तू? पार्शालिटी करणार नस ना तू? Your choice, तू तिथेच जाणार.
Yes.
So do you see why am I probing him like this? He is the one who had chosen to do the gaming for that particular time. जो उसको लगा सही और बहुत मजा आया, because he in himself created it, because his capability was taking shape. So acceptance is the problem. Sudeep is not accepting his own self, himself, for choosing Ayurveda right now. Do you agree to that?
Yes.
At the same time, he is depriving himself of the joy that he feels, even if it is for a while he could have achieved it. Yes or a no?
Yes, ma'am.
In so many aspects of our life, this is what we do. Though he wants the fun and the freedom here, though he has chosen BAMS, he is doing good at it, but he's feeling strangulated. And did you see how the physical manifestation was so prominent? You started sweating there. Now, as you move behind, your acceptance is very different there, isn't it?
Yes, ma'am. Definitely.
And what if I tell you, Sudeep, you are not only the one who is doing the gaming, and you are not only the one who is doing Ayurveda. Some part of you is this and some part of you is that as well. Both are your truths. Yes or a no?
Yes, ma'am.
Don't you think you owe an apology to the one who has chosen Ayurveda? That have not accepted you and allowed you to be burdened all the time. He is really trying hard. Imagine if you accept him deeply, how he will perform then.
Definitely good.
Huh.
अच्छे
So
करेगा
turn
वो
towards
बिल्कुल.
him, please. You better say sorry to him. Turn towards him. Turn towards this Sudeep who is doing Ayurveda. आणि त्याला सांग, सुदीप मला माफ कर. सांग.
I'm sorry.
अरे यार, थोड़ा तो दिल से बात कर. जरूरी है क्या? थोड़ा दिल से बोल ना. सुदीप मला माफ कर.
I'm sorry.
और दिल से. मैंने
और
तुझे
बड़े दिन.
हाँ, मैंने तुझे आयुर्वेद दिलवाया. मैंने बोला, but I am not supporting you for the same, because I'm constantly craving for freedom and fun, and my creativity lies here. But I'm sorry, I now choose to take your responsibility. Use these words. Sudeep,
Yes, ma'am.
tell him. Should
Sorry.
I talk in Marathi, Baba? Tell a
Sir,
sang. Ha, so repeat after me. Sudeep,
Sudeep, sorry.
I am sorry. Mala maaf kar.
I'm sorry for burdening you to select a BMS and to keep you on the track for that only.
Yes, and I made you feel it like a burden. I am sorry. Please forgive me.
Forgive me for this choice and for the decision.
कसं वाटतंय तुला?
Like,
लाइट हो रहा है कि अफसोस हो रहा है? पहले अफसोस हो रहा था. अभी लाइट कहाँ फील हो रहा है बॉडी में?
ये बिल्कुल मतलब बहुत भारी हो गए थे पहले, अब हल्का लग रहा है.
हल्का लग रहा है. Please observe these symptoms are real for him, which is coming from his thoughts, which is coming from his belief system that I won't be free if I do Ayurveda. I'll feel the freedom only if I do gaming. I won't be able to earn better if I do Ayurveda. I'm just slogging like a donkey. These are the words he had used. And I can enjoy only if I do gaming. I'm capable only there. Now, Sudeep, at the same time, you're doing BAMS but not being supportive for him. And at the same time, you're not allowing the Sudeep who is so creative. Do you agree to that?
Okay. Yes, ma'am.
तू त्याला पण निग्लेक्ट करतोच आहे ना?
Yes, ma'am.
So you need to say a sorry there also. Please tell him sorry. I did not allow you to feel the freedom.
Yes, ma'am. I will say sorry to him also.
Okay. So now what I want you to do is open your palms and is this video on pause? Anand?
Yeah, looks like, but I think only the video may have paused.
Can you hear me,
Sudeep, are you able to hear us?
Yes, ma'am. Yes, ma'am.
Okay.
Yeah, okay.
तू त्या पोझिशनला पुन्हा जा. ठीक आहे? हा. आणि तिथून open your palms, feel the sensations in your palms, and believe that you're accepting both the parts of you within you. And very genuinely within, because the self-talk is always on for us. But are we aware of what kind of self-talk we are having? So accept both of them, saying, I am sorry, please forgive me. I thank you for what you are, and I love you for what you are. As you say this, Sudeep, very slowly come ahead, walk ahead. I don't know, the video is paused, but slowly walk ahead and observe.
Ma'am, now I am visible?
Not yet.
Am I visible now, ma'am?
Not yet, bro. Did you walk
Yes,
ahead
we can
and
see
come?
you.
Gila.
Ma'am, I think there is a network issue.
No problem. Sudeep,
Yeah, we can see you now.
Sit.
We can see you now.
I want you to sit back, Ata, and I want you to share with us what are you feeling right now.
इसके पहले पाम बहुत गर्म थे और जैसे आगे आया पाम पूरे ठंडे हो गए टेंस लग रहा था टिकलिंग हो रही थी सेंसेशन पहले अभी थोड़ा रिलैक्स लग रहा है
रिलैक्स्ड हो रहा है अभी आप चेयर पे बैठ जाओ वापस चेयर पे बैठ जाओ What is happening in your mind when it comes to getting clarity for this dilemma?
It feels like lightness in the body and
lightness in the body.
भूख लगने से पहले
भूख लगी है
भूख लगने से पहले जैसे हल्कापन लगता है वैसे लग रहा है
Nice. And the burden that you were feeling of Ayurveda, do you feel you are more accepting and responsible for the choice that you have taken now?
Yes, ma'am. Definitely.
Sure. Thank you, Sudeep, for being honest and open to the group and sharing your dilemma.
Thank you. Thanks a lot, Dr. Sudeep.
So what we did now is called as tetralemma, Chatushkoti. This is psychological Chatushkoti, 4 steps. So wherever, and very importantly that I wanted everybody to know that it is the physical symptoms which is caused due to deeper emotional stuck energy for some reason or the other from birth till today in many ways. which we are not even aware, which is very deeply stored in the subconscious state. But this brings out the subconscious very beautifully, and hence NLP and Gestalt are wonderful ways to find the root cause of the problems. So Anand, we are actually short of time. So what do you want me to do? How much time do I have?
We can take around 15 minutes more, Dr. Trishna.
Okay, so
Not a
I'll
problem.
quickly run through the slides. It might just feel as though I'm just reading it, but I'll be reading it slowly so that you all can check on yourself. Where do you stand in this sentence, in this word? What is your state? Yeah, next slide, please. The positive thought, if planted using the placebo effect in the brain, it will alter the belief system that will trigger the body to release its own natural pain relievers like endorphins, dopamine, which reduces the physical symptoms. So the belief system that Sudeep had, that I won't be able to have fun or feel free if I choose and do Ayurveda, that was the belief system, right? The moment the placebo effect, the positive thought when he instilled that it is my choice, I need to take responsibility to it. And the pain was relieved. The physical symptoms that were of discomfort got released. Do you agree to that, Sudeep?
Yes, ma'am.
Yeah. So next slide, please, Anand. The concept of primary gain. Many times when you look at patients, bahut bar, there are ways wherein they are taking regular medicines, but they do not appreciate the changes within them. They like to come again and again. They like to gain your attention. हमको ऐसे लगता है इसको ठीक होना ही नहीं है. बहुत बार ऐसे अगर you all have come across, right? अरे होना ही नहीं है, मैं करूं क्या? But we have to see that if they are bringing in symptoms, it is also that they are having certain primary gain or secondary gain for being sick. Okay? So, it's the formation of physiological symptoms for psychological conflict. Now, the conflict is coming from their past when they were children, having some relationship issues or parental issues, which will keep one devoid of guilt and unaccepted emotions. So that's how we cover up the hurt, pain, guilt, remorse, lot of things. For example, you do not want to, when the child does not, they don't want to go to the class, that will cause them guilt of not going, and they will start having symptoms like headache, indigestion, etc., more physiological symptoms to cover up the guilt. And because now they have physical problem, they are okay. Now I अभी तो मैं तो बीमार हूँ, मैं तो नहीं जा सकता. So how it is manifested, if you have this perspective, you will be able to understand where or what space your patient is coming from. Next, please. The secondary gain, illness or diseases that we experience are mostly inflicted by yourself on the body. We tend to cause harm to ourselves as form of coping mechanism in order to the avoid the exam sometimes. People have nausea, vomiting. I don't know if you have come across. That's a coping mechanism of fear. There is a clear line between conscious and unconscious causing harm to self. It is related to genuine needs. My need is to be feeling protected. I don't want to face the difficulty. So, the behavior of the child wanting attention from parents, you must have seen that they throw tantrums. They really avoid going to classes. They are physically ill because they want attention from their parents. And also the smoking, overeating, all of these are the causes, the lifestyle damages which are happening because of the secondary gain, which are deep rooted emotional traumas. Next, please. Illness and emotions are very powerful than words. Our emotions can create illnesses. Emotions, if they are expressed and experienced freely, Without any judgments, they will flow fluidly and will cause healthy mindset and physical strength. And the emotions which are repressed and suppressed, fearful and negative, harmful and draining, they are negative for our body and weakening our immune system. Please try to fit yourself and observe in what many areas are your emotions curbed. Maybe because of the belief system that, oh, you should not talk loudly. Oh, what if I tell him this? What will he or she think of me? So we are suppressed in a lot of ways. Next, please. Your body speaks your mind. It is important to identify the psychosomatic symptoms as they are the physical symptoms that mask the emotional distress. When this root cause, the emotional and the psychological barrier of certain diseases, remains unattended for a longer time, the symptom soon becomes a habitual occurrence. It will worsen with similar emotional barrier if experienced later in life. इसमें व्याधि अपुनर्भव चिकित्सा नहीं किया तो क्या करेंगे? Emotions में. Try and think of that. It will strengthen the physiological symptom even more and will extend the persistence in the body. Go ahead. Beliefs. The firm thoughts that we possess because of experiences are called beliefs with emotional baggages. Generalization of something that we hold may or may not be true but accepted true by us. Assumptions that we make for ourselves and others. Pause. See what you believe and see how is it affecting you negatively or positively. Perhaps believe Trishla who has been a daughter. The belief as a daughter perhaps not help her in being a doctor or a counselor. Am I grown up enough to take charge of the belief or make my new belief? If we do not take the responsibility of the beliefs and the values, we are going to create that negative effect for our own self. Values are these stable, long-standing beliefs, and it becomes our standard of living or whatever the rules and the principles and the ethics that we make. And people make their life choices, attachment and commitment to the beliefs. It does not matter if it is true or false. Next. Self-esteem. How important it is for us to know that I am capable, the ability to think for yourself and to have the respect. Do you really respect yourself? Ask yourself for what you are. It's internal, your thoughts, your beliefs, your self-image, your subconscious mind, everything is at play. The 6 pillars of self-esteem is the practice of living consciously, practice of self-acceptance, practice of self-responsibility, the practice of self-assertiveness, living purposefully, and personal integrity. This is a vast thing, but self-esteem is like saving account of feelings and emotions of yourself, which we do not cater to because we are supposed to see others benefit first, right? I was being sarcastic here. Please look into your feelings and your emotions because you have to hold them and accept them well and nurture them well because it's about building your own saving account for the same to make yourself feel accepted, respected. When you are nourished well, you will be a better doctor and better roles that you play otherwise. Next, please. So what kind of a self-talk or the dialogue are you getting into? Are you aware what are you talking to yourself or are you bashing yourself? Are you punishing yourself? Are you feeling guilty for whatever you have done, whatever it is? So this will reveal your thoughts, beliefs, ideas. Is it positive? Is it negative? Is it encouraging to you or if it is distressing you? Observe. Next, please. The neurological levels of change Now place yourself in any situation. These are the 6 areas in which you might feel that you are facing problems. As the role of a brother, a husband, a father, a doctor, whatever. Is it the environment that is causing problem to you? Is it the behavior, the capability, the beliefs and the values that you are holding, or the identity, the what role are you playing, or the vision or the goal that you have in different areas? Place yourself in these 6 categories and observe which part of you needs forgiveness, which part of you need nourishment, which part of you needs motivation, acceptance. Ask. These are simple words, but with lot of weightage. Give them more value to yourself. Next, please. So body sends us a lot of messages. Please pay attention. Make amends with your emotions for a healthy life. That's it. Thank you so much. I just tried to catch up a little. I'm sure it was a little heavy for you all. But even if one sentence made sense to you all, I hope you can integrate in your life. So any questions, if anybody has, I'm open to them. Thank you, Dr. Anand. Yeah, Dr. Anand, for the screen sharing.
Thank you, Dr. Trishla, for such an amazing session today. We'll just start with the Q&A then.
Yeah, sure.
Yeah. Can you just check the chat here? Can you please put your questions in the chat box, please? If anybody wants to ask any questions.
Thank you, Dr. Anju.
Okay, we'll just hold.
Sure.
We'll just wait for another few seconds, 20, 30 seconds. If anybody wants to ask any question.
Sure.
Yeah,
Also,
yeah,
that it's very important that flexibility will come from having a lot of choices, but the wisdom will come when we have different perspectives. So try and get into understanding the perspectives, the mind map of people. It is very important to understand your mind map so that you can understand the other person's mind map. Yep.
Thank you, Dr. Trishla, on that.
You're welcome. हमेशा ताल्लुक रखो हमसे ताल्लुक रखो तबीयत ठीक रहेगी हम वो हकीम हैं जो लफ्जों से इलाज करते हैं Thank you, thank you, thank you. Thank you, Dr. Praveen. That was a nice one.
Thank you, Dr. Praveen.
So yeah, this word, yeah, the other is Gestalt, Gestalt, Gestalt or Gestalt. It is also called as the chair therapy. And yes, that's right. So the chair therapy is so beautiful that the cases that I have had, and when I ask my patients, what is it that you are feeling? How are you feeling? And the most common answer that I get, like for example, I have a 44-year-old patient, and they would say that, Doctor, I feel I have grown up today. Because there are so many hurt and pain and betrays that they carry. Perhaps if that incident must have happened when they were 10-year-old or a 12-year-old, and after the Gestalt therapy, they feel that they have grown up to their present age. Are we really carrying all the parts of us or not? Hence, the Gestalt therapy is very, very important. And I would say that is the root cause of the problem, of the emotional trauma. So yeah, that's Gestalt. Gestation, yes, it does. It does, because we do carry ancestral traumas also. Blood ties, lot of things. It is, but that's a very deeper science. It just depends how deep you want to go. It can be gestation. We can work on it for sure. I also feel everybody that जब दवाई लेते हैं तो हम रेगुलर दवाई लेते हैं ना, 10 दिन की दवाई करी, you come back, take again 10 days. And it is so important that if we need to seek help. Let's not shy away to seek help, because the more you express, the more you feel, you can be your authentic self. And take help, deal with your emotions. It will increase your productivity drastically in all areas of your life. And I really think this needs to be implemented by everybody. So yeah, whenever you feel stuck, take a pause and see if you can be committed to yourself to open up. Yeah.
Thanks a lot, Dr. Trishla. That was great there.
You're welcome.
So,
there is
yeah.
one more, Anand, actually, thank you, Dr. Anju. Dr. Prithika, she has one experience. If we have 2 minutes to listen to her feedback so that the other doctors can have a better view towards it. If Dr. Prithika is in the house.
Yeah, I'm just
Yes,
checking.
ma'am.
Sure.
Hello?
Yes. Please go ahead.
Yes, ma'am. Am I audible?
Yes, Dr.
Hello.
Prithika, we can hear you. Yes.
Okay. So this is Dr. Pratika, and I was suffering from severe back pain since around 2 years. So there was obviously a mechanical cause, but the amount of pain and the discomfort that I was going through was somewhere not being relatable to the mechanical cause that had happened. So I was taking medicines, which had helped me a lot. But occasionally one day that we happened to start a therapy. So I have done 3 to 4 sessions with Dr. Trishla ma'am. So what I have noticed is there was a drastic shift in the pain. Other than pain, therapy actually helped in all aspects of my life, which is unexplainable. Everybody has to experience it on their own to be able to express it. Um, even in my emotional state. But since today's topic is about physical thing, so there has been even some instances where my pain scale has gone from 10 to 3 to 2 immediately, just 2 minutes or 1 minute after the therapy or after a small activity that we have done. So through all my therapy experience, I've understood how our emotions trigger our emotion, how our emotions trigger the muscular pain. Like physically, I felt the pain reduced, the muscle spasm also reduced, and even before the therapy, my calf muscles used to be very tight. And just after the therapy, I used to feel lightness in my calf muscle, lightness in the body. And as Dr. Sudeep said today, there's always a feeling of more hunger because the ajirna goes away, of the emotional ajirna, and your sleep increases, the weakness of my limbs, weakness of my muscles. I've seen my physical improvement only through the therapy. So we always cater to the Malavashtamba part of it. But with Dr. Trishla ma'am, I understood how important it is to cater Manavashtamba also in our clinical practice. And my emotional factors, because of this therapy, I am able to understand. Even now I get pain on and off whenever I get any physical ailment. I'm able to understand the emotional perspective of it, the major emotions being guilt or burden or finance or uh, inferior complexity or anything, but I'm at least able to sit with myself, talk with myself, and the amount of self-hatredness that I used to have before therapy was unimaginable, and it was very hard to believe for myself because there was so much disconnect with the self. So as ma'am said, it teaching us how to sail through the ocean, but it is our responsibility to keep sailing with the help of ma'am, of course.
So I hope you take emotional medicine every 10, 20 days regularly
Yes, ma'am.
henceforward.
Yes, ma'am.
हेतु सेवन ज्यादा हो रहा है.
Yeah.
But काम पाचन नहीं हो रहा, शोधन अगर नहीं करा तो भ्रूण का टाइम कब आएगा?
True.
Yeah. Thank you,
Yes.
Dr. Pratika. I
Thanks
hope
a
this
lot, Dr.
helps.
Pratika. Yeah.
Thank you so much for sharing. Thank you.
Thank you, ma'am. Thank you, sir.
Yes.
Cool. That's great. Okay. So we'll just wait for just one last question if there is any, and if anybody would want to ask any questions, please. If anybody wants to ask a question, please use the chat, or you can unmute your mic and you can directly ask as well.
You can also share my number in case there is still avaran of expression. They can talk to me personally, right?
Mhm.
Because it takes a while. It's not easy to open to your own vulnerabilities. I'm not here to judge, but by helping yourself with it will really help you open up a lot of doors for progress in life, which is a spiritual goal also.
Okay, so I'm just going to share this for the benefit of everybody.
Sure.
Just for a few seconds. Okay, so if we do not have any more questions, we'll be closing the call, this session here. So thanks to all the participants to be here with us for this amazing session. Special thanks to Dr. Trishla again for conducting this session. And one last announcement is, dear doctors, please note that we shall be having our upcoming Gyaan Vardhini session number 8 on 23rd of July, which is a Tuesday, by Dr. Hetal Shah. And the topic is HLA B27, an answer by Ayurveda. So we'll be closing the session here. Thanks again, everybody. Wish you all have a
Thank
good evening.
you. Thank you, everyone.
And
Thank you, Anand. Thank you,
Yeah,
everybody, for having such a nice listening ear. Thank you.
thank you.
Thank you.
Good night. Bye.
Good night.